Dr. Davis, about liposuction, you have a new machine which somehow operates a little bit different. Tell me, it works better apparently, it gets better result. What about safety? What about the patient's safety? Is there anything which has an advantage there also?
This is an extremely safe method. It's more safe than traditional liposuction. You avoid the risk of general anesthesia. You also avoid the risk of excess bleeding and bruising. And then I think it's also safer than the other in-office liposuction machines that have been around for a few longer years. The other in-office liposuction machines that have been available work by heat, and they have a higher risk of perforation of the bowel, going deeper into the tissues where you don't want. And because they work by heat, you can burn the patient, you can burn the skin, you can burn other areas, and they're just not as safe. And also because they work by heat, they also heat up the fat. So if you want to try to collect the fat, you're obviously going to be killing some of the fat. So if you want to collect it to use it again immediately into the face of the hands or any place else in the body, the fat isn't going to be as alive. So the take rate or the alive rate to put into your face or your hands or somewhere else isn't going to be as high. So the results won't be as good because the percentage of fat that's alive won't be nearly as high. So the patient will have not as satisfactory results cosmetically when they're finished for the face or the hands or elsewhere. They may have good results as far as the liposuction itself, but they do have a higher risk of complications from that.
So that's one of the reasons I've gotten that new machine also, because I know you've been waiting for it for a while.
I have been. That's why, because I thought it was just much, much safer, much more gentle on the patient, and much less risk to the patient. We have had no complications. The complications with this machine, from the time it came out into Europe and all the times in the United States, is almost zilch. We do use lidocaine as the anesthetic agent in the body, and we are very conservative. It's based on weight, and we take out what we put in, so the risk of toxicity is minimal. We're very conservative with that, and the patients are kept very comfortable with that, and it's just a very, very, very safe procedure.
Well, wonderful. And as you mentioned in the other video, the patient recovers much faster afterwards. They can be back to work, which is quite a nice thing, I guess.
The other thing, too, by doing this, and as I have mentioned previously, the cannulas that we use are so small that the tiny little incisions that we have to make are so small, sometimes we have a hard time finding them when we even do the checks post-operatively. They don't even require suturing. They're so small. So, which is very nice because the cosmetic result from that is also very nice. Whereas with a regular liposuction, it does require suturing.
Wonderful. And then there's still the advantage, which I don't think, which with the liposuction, which uses heat, it destroys the fat cells and or the stem cells, whatever you want to call it, and then you cannot reuse it anymore because it comes out dead, basically.
Well, they try, but the salvage rate is very low. They try to reuse it, but the salvage rate is just very low.
And with this one, it's very high,
extremely high.
And a patient can now use it in different body parts. On one hand, he takes it out. On the other one, he needs it to fill it up, right?
Right.
Okay, good. All right, so it's a safe procedure, safer, more convenient for the patient than the ones before.
Right.
Good to know. Thanks, Dr. Davis.